very, very, very complicated fashion, and there is going to be a tremendous onus on us, the individual American consumer, to pressure the people who represent us to do the right thing and not just something. There is a right, and there is a wrong, and then there's stuff that you really need to do. You just get something to do something. So we're really going to need to work. Yes, Charles?
You cited all these page numbers. That's true. I think the 676 is 36 pages long.
Right, so we can all go home and we can read that. It was meant to be understood. If it takes you 800 pages to explain it, it's complicated. So it's going to be very expensive to try to enact it. Now, one of the things that we wanted to do when we originally put this forum together is we wanted to make certain that we included the perspective of medical doctors, people who were in the business of providing health care. And in my mind, that would have been, for me, the very first place, if I had been in the Senate, where I would have gone. Not just to the insurance companies, because insurance companies do not provide health care. All right? You do not go to Blue Cross and Blue Shield to get health care. You go to Blue Cross and Blue Shield to beg them to pay for the health care that you need. All right? Now, when we bring the doctors in, which is really, as I've said, what was very, very important to us, it becomes very important to have the doctors, as they've already started to do, explain why this is so incredibly important. Now, I don't know if everyone followed it, because here in Richmond it was more of a footnote, and other newspapers and on the internet it was a very big note, that a number of doctors went to the Senate Finance Committee hearings, headed by Senator Marcus, and they wanted to be a part of the hearings on health care. And they were arrested. And yes, and so one of those medical professionals who is a member of, now Dr. Flowers, are you the Baucus 8 or are you the Baucus 13? I've seen those numbers.
Well, there's 13 altogether, but I'm not later we're 8.
All right, she is a member of the Baucus 8, a group of physicians who went to a public hearing in the United States Senate to talk to the people who are going to make the definitive decision on health care about the doctor's perception of what health care should be. Dr. Margaret Flowers.
Thank you for inviting me here this evening. I came with one of my colleagues, Dr. Carol Paris. Will you wave your hand here? They're late because we were actually at our hearing for our event. I'm really glad to see all of you, and very honored to be sitting between these two distinguished gentlemen, single-payer champions, I know they are. I guess for me, I just want to tell you a little bit about why physicians support single-payer, and how I came to this position that I never thought I would be in. So when I came out of my residency training, I trained at Johns Hopkins and felt like I had received a very good quality training and was ready to go out and take care of my patients, and kept running into this problem, which was the insurance companies, which when we would make decisions on what was best for our patients, the insurance company would make decisions based on what was best for their profits, and often they were not in agreement with what we thought was the right thing to do. And as so many of my colleagues, felt the same way. You're fighting to deliver care, and it's really interfering with your ability to have a good relationship with your patients and to develop that caring and trusting relationship that's so important. So I started kind of looking into what was going on with healthcare reform and did a little research there, and saw that for so many decades we've been trying to patch together this very abnormal situation that we have here in this country, which is very different from any other industrialized nation. But rather than chuck it, we want to keep doing the American thing of trying to patch it. And the result has been more and more cost and less people being able to get health care. And more doctors dropping out of delivering health care, which is what I finally did. I finally said, I'm not going to practice in an environment that pushes me to deliver substandard care. I'm going to go out and fight for what I believe is the right thing, which is to create a national health program that serves every single person in this country. That's what they have in every other industrialized nation. And not only does it improve health, it costs less. It's a winner all the way around. It's the right thing to do. The problem is the insurance company. So I joined this organization called the Leadership Conference for Guaranteed Healthcare. Actually, it was running the Maryland chapter of Physicians for National Health Program, and we became part of this leadership conference. And so when President Obama was elected, we were really happy because he had spoken out on behalf of single payer in the past. He also said healthcare is a human right, and we're like, great, we'll build the movement, and he'll go there. Everything is great. And what we found as we started organizing and meeting with members of Congress, which we did quite regularly, beginning in early December, saying, as you go through this healthcare debate, include our viewpoint at the table. Let's actually talk about what's best for the country. And the more that we pushed, the more we were getting shut out. And so when it came down to Senator Baucus's roundtable discussions, and we looked at who was invited, of the 41 people who were invited to testify over 3 days of roundtable discussions, there was nobody representing our viewpoint. There was the CEO of Blue Cross, and Karen Ignani from AHIP, and Billy Towson from Pharma, and the Business Roundtable, National Federation of Independent Business, Heritage Foundation, all these conservative business-oriented groups, but nobody representing patients or doctors. And so we wrote a letter, and we said, will you include one of our people? And they said no. And so we started having people call in nationwide, thousands of phone calls, and they still said no. And it became very clear that they didn't want to hear what we had to say. Because if you talk about single payer, it wins on every single point. From a policy standpoint, it's universal. It allows physicians and patients to make medical decisions. It removes the financial barriers that we have to care, which are premiums, and premiums, but co-pays and deductibles. It ends the bankruptcy that occurs in this country as a result of people trying to pay for their care. And it saves money. So we knew that if we were at the table and had that seat, we would win. But we knew who was controlling those seats at the table, and it was the people who had, I'm sorry to say, paid to be there. And that is the health insurance industry and the medical industrial complex. So we knew that we were at a point where we had only really one choice, and that was to make it obvious what was happening. And so 8 of us went down there that morning, ready to testify. That was our point, was we would like to have a seat at the table. We let one of us testify, and as you heard, each one of us, as we stood up and asked to have a seat, were arrested. And then the following week, for the 3rd round table, after again we went through the same process, I was on national TV asking if they would include Dr. Marcia Angel, the former editor of the New England Journal of Medicine, an expert on healthcare financing, if they would allow her to have a seat at the table, and they said no. So the next week, it was Florence Nightingale's birthday, and so 30 nurses came. And as the hearing was opening up, they stood up and turned their backs on the senators, and they had signs on their backs that said, nurses say patients first. No to AHIP, that's Health Insurance Lobbyists, pass single payer. And after about 5 minutes of standing there while Senator Baucus was opening comments, they filed out quietly, and then 2 nurses, 2 doctors, and another advocate stood up and asked to have a seat at the table and asked to have single payer included, and they were arrested as well. So, we're at a point in our nation. We've been wanting a national health program. It was supposed to be part of the New Deal, quite honestly, but FDR had to take it out of the package in order to get the rest of the package passed. And unfortunately, that was due to racism and what was going on in the South. But I hope we're a little bit beyond that now. And we've been needing this for 60 years. The other nations did it, and we didn't do it. And so we have this opportunity right now. I just see it as such a great opportunity. Between the economic crisis that we're in, we must fix healthcare if we're going to recover economically. With the number of people who are unable to get care in this country, 14,000 people a day are losing their jobs. And with that goes this abnormal situation of having your health insurance tied to your employment. So the growing numbers, I think the last number I heard was 53 million people in America don't have health insurance. we're watching these Kaiser Family Foundation